Good afternoon, everybody, and welcome to the West Berkshire Health and Adult Social Care Scrutiny Committee. I'm Councillor Martha Vickers, Chairman of the committee. Members of the committee present this afternoon are Councillors Dennis Bennyworth, Nick Carter, Martin Colston, Owen Jeffrey, Paul Cander, David Marsh, and Stephanie Stevenson. Gosh, it's lovely to have so many from just the 5 previously. And Councillor Alan McCrow, I think, is hoping to join us via Zoom. Councillor Heather Codling is also present as Chair of the Health and Wellbeing Board. And the council officers joining us to advise and support the meeting are Anne-Marie Dodds, Executive Director of Children's Services, and we are expecting Stephen Bow, Consultant on Public Health. So maybe he'll be with us in a minute because we are just a tiny bit early. Vicky Phoenix is the clerk for the meeting, and the meeting is also being live streamed via YouTube, and Thomas Radbourne is a Zoom host. Before we start proceedings, I'd like to explain for the benefit of members of the public who may be watching that this afternoon's meeting is being held both over Zoom and with councillors present in the council chamber. The meeting is being live streamed on YouTube, so members of the public are able to follow proceedings. Please can I ask everybody participating in the meeting to make sure they switch on their microphones or invited to speak directly into them and to switch them off when finished speaking. If we hear the fire alarm this afternoon, we must leave the building immediately by the emergency exit. The assembly point is the Dolphin Car Park. If the lockdown alarm sounds, and I think we were treated to that at our last meeting, which is quite an alarming sound because we never heard it before, we will remain seated and await instructions from officers. We'll adjourn the meeting until such time as it is safe to proceed. Do members have any questions about the way in which the meeting will be conducted before we proceed? No. Right, Vicky, do we have any apologies?
Yes, Chairman, we've received apologies from Councillor Joanne Stewart.
Thank you. Turn off. Welcome, Steve. Sorry, I've only just been doing the fire alarm stuff. Thank you. Sorry, we started a minute early. Sorry about that. So item 2, declarations of interest. Does anybody have any declarations of interest related to items on the agenda? No, nobody's nodding their heads. Right, and item 3 is our consideration of the report. Before we start, as chairman of the task group, I'd just like to say a few words about the task group and the purpose of this meeting before inviting your comments and questions. So the Children's Mental Health and Emotional Wellbeing Task Group was set up in response to increasing concerns for the worsening of the mental health and emotional wellbeing of the young people in West Berkshire, and the awareness that mental health problems in childhood can have a negative effect on future development. Over the period from November 2024 to May 2025, the task group met and took evidence from a wide range of services in order to understand the service provision and identify areas for improvement. The terms of reference are in your pack, and the detailed notes from each session outline the evidence given and questions raised by members of the task group. The members of the task group were myself, Councillors Martin Colston, Stephanie Stevenson, who are here today, Paul Dick, Clive Taylor, and Owen Jeffrey. The task group has completed its work, and I'd like to thank all of those who took part for their contributions. The purpose of this meeting is to ensure that all members of the committee are fully informed of the work and recommendations of the task group and have the opportunity to ask questions for clarification and to ensure there are no gaps in the recommendations arising from the discussions before these recommendations go to the executive and Bob ICB. The members of the task group asked for this special meeting today in order to move things along and ensure that the recommendations reach the executive and the ICB as quickly as possible, because normally they would have just been sent to the September meeting. A report will come back to a future Health and Adult Social Care Scrutiny Committee to confirm the executive and the ICB responses. So I'll just move on now to see if members of the task group might have their own points that they wish to raise, things from the recommendations that they are particularly keen on and support. But obviously for the rest of the committee, they might well have questions about the recommendations and related to the report. I think one of the comments I'd like to make about our findings is just that it was constantly obvious to us as we went through taking evidence, the real importance of support to families in early years in order to identify problems early and to make sure that services are put in place early. So that was the thing that has stuck in my mind, but other members might have other items which they want to highlight. So I'll just move on to members for your comments and your questions. Councillor Colston.
Thank you very much, Chair. Unfortunately, my council laptop has broken, so I can't see my notes, but I was looking through it this morning and keep the points that are stuck in my head, the three of them from the report. The first one was that I can't remember the exact percentage, but something like 70% of our schools in West Berkshire have got a mental health support member of staff, but it's only 70%. So that means that 30% do not have that. And I think the funding for that has come from central government. But it means that those 30 schools and pupils in those 30 schools are disadvantaged in their mental health support. And we wanted to see if we could get that support in every school. Secondly, there's support for Berkshire schools from one of the mental health I'm sorry, I've forgotten what it is, MH something or other. Vicky, you probably know.
Mental health support team.
Yes,
MHS.
but it doesn't cover all of our schools, and particularly schools in the east of the region of West Berkshire are not covered, and we wanted to try and make sure that that was funded for all schools. And the last point I had was about our youth service offer. As we all know, youth services funding for them has been cut dramatically over the last 12, 15 years in real terms. Berkshire Youth are doing a great job where they are. Clearly, if you happen to be a child or young person in Newbury, you've got the Waterside Centre that you can go to, but there are lots of places in West Berkshire where there are no such facilities. And so we wanted to try and make schools and other locations available to try and help provide something for our young people who don't happen to be living in Newbury or where there are already youth services. And I think the government has recently announced, haven't they, last week, some extra funding for youth services that they want to try and push that. Did I read that right? It was quite a few £1 million. But it would be good if we could try and tap into that if we qualify to try and improve or expand our offering for young people across the whole of West Berkshire.
Thank you,
So
Councillor.
those are the points for me, anyway. Thank you.
Thank you. That's really very useful. I don't know whether the government is whether that linked to this extension of the hub to 19. Is that funding? Is that sort of all in that package? Okay. I mean, this report will also be going to Children and Young People's Scrutiny Committee, our new Scrutiny Committee, and I know they will be looking at the hub there. So there'll be an opportunity again for them to be aware and to, to consider this as well. So it can go in sort of several directions. But yes, I mean, the use of the schools, I don't know whether our officers want to comment here or whether that's just something we'll wait and see what happens. But we thought that would be a good use of resources that we already have.
Thank you, Chair. Mental health support teams in schools are funded by the ICB, the Integrated Care Board. Until this year, they have commissioned West Berkshire Council to deliver our mental health support teams in schools. They are no longer commissioning the council to deliver. They have a single commission with Berkshire Health Foundation Trust, which will take effect from August. So we are no longer commissioned to deliver mental health support teams in schools. It's a single commission across the whole of Berkshire West. We don't know what that will look like yet. What we do know is that they are going from a community-based model, which we have had, and we have had one of the most effective MHSTs in the country. They are going to a medical model. So children are likely not to be receiving the support in schools, but children will be going to a health setting to receive the support. So there are significant changes. The council did bid a collective bid with the other Berkshire West authorities, but we were unsuccessful in that. I do understand there's also been legal challenge to the procurement of the commission and the procurement of the service by the ICB, so it hasn't been without its issues. I think to pick up Councillor Colston on the other point, where we didn't have MHST support across all of our schools, previously, we did receive money from the ICB to run the Emotional Health Academy, which I'm sure colleagues are aware of, but I have subsequently had email correspondence from the ICB to say that they plan to withdraw the funding of 150,000 towards the Emotional Health Academy. So I think it's worthwhile understanding that it has been challenged. I've challenged it with the director of the ICB, but I'm awaiting a further update from the ICB as to whether they will or will not continue to fund the Emotional Health Academy in West Berkshire. But essentially, we have lost ownership, if you like, of both potentially the Emotional Health Academy and mental health support teams at schools due to decisions made by the ICB.
Well, that's very worrying. Obviously, we've not got anybody from the ICB here today. I mean, I suppose we do need to probably be considering whether we want maybe further action or really whether this group tries to lobby the ICB. I mean, obviously, they're a consultee, but in view of what Anne-Marie has said, maybe we need to have some stronger message there to basically say that we're concerned.
Yeah, I mean, I would agree. I mean, the whole reason that the task group was set up was because we were concerned about the level of provision, and it sounds like both of those things are going to further deteriorate the position, which already was far from ideal. So I think, yeah, we do need to try and do something.
And that, to some extent, it's sort of been taken out of our control. That, you know, that I mean, it would be good that they're sharing the burden, but we need to, you know, be part of, it's meant to be about partnership working. Councillor Mott.
Oh, yeah, okay. I mean, I was just pulling a face because I share the dismay that some of the members seem. I was actually going to ask if, first of all, their excellent recommendation, I was going to ask if they applied to academies as well as our own schools, West Berkshire schools. But it may be irrelevant now from what you say, because I'm not sure how much control as a local authority we have over this, which rather runs counter to many of the recommendations in the report, Chair. Can we find some way to express this to the ICB, perhaps? Or is that pointless because the decision's already made?
I think we do. Well, as I said, the report goes to the ICB, but maybe we need some sort of covering letter or something just to say, look, we have recently been made aware, and maybe we need to make sure we get the facts right, you know, what Anne-Marie has just told us. You know, we strongly would like your response. We've spent some time on this, and now we suddenly see that these concerns that we've raised, serious concerns, we now find that we're facing a worse, you know, scenario than we thought we had. Yeah. Codlin.
Thank you. As Chair of Health and Wellbeing, I'm concerned about this, obviously, as well, and as well as my portfolio for children's services. But my concern is that the ICB is not the organisation it was. You know, we're awaiting at the next Health and Wellbeing Board an update on what the situation is with the ICB, because they've had their funding cut by 50%, their staff cut by 50%. I can't see if the ICB is the right, you know, who do we appeal to? Well, maybe both our MPs of this area.
MPs. Yeah, I mean, we have been this is all related to reorganisation, etc., of the ICB. Councillor Stevenson and myself attend the Joint Health Overview and Scrutiny Committee, which brings in all the local reps from all the local authorities that deal with scrutiny, health scrutiny. And that's going through, is in a bit of a state of flux at the moment, but there is a move to get a meeting together to actually, with representatives from the ICB, to find out exactly what's going on. And if that happens soon, I mean, the chair of the Oxfordshire Scrutiny Committee, who possibly will be the future chair. It's without a chair at the moment for various reasons. I'll try and contact her and just see what's happening with that meeting. And that might well also be something where we could raise our concerns about this as well. So Carter.
Hello there. Yes, I'm just to clarify, I'm sort of new to the committee in its current form, so I wasn't involved with the Task and Finish group, and great work, obviously. So my comments are just general to do with promotion of things generally, not this specifically. So the couple of things I thought were of note was the youth offer. It mentions, that's a recommendation, the youth offer. It talks about engaging with stakeholders, town and parish councils, which is fine. But I sit on a parish council, and if we had that come to us, we'd think, what do we do with that? I would hope that the youth offer is also going directly to the public, and we're going to try to get it out there and not assume that it's just because they list the stakeholders as being town and parish councils. It doesn't say the public, which concerns me a bit. So it's just a general comment on anything that involves an offer. It's always difficult to get to the actual people that need it, and you need to, I think, go to all the possible avenues, which specifically is us taking responsibility to try and communicate it. And then similarly, the family hub has been the local connection. The problem we have in the villages is that our nearest family hub is in Calcott, which is quite a trek from our particular patch. But maybe this community outreach hub is going to pick this up. I don't know whether that's true or not. There are community outreach hubs that are going to pop up in the villages, and maybe that's the way. But again, it's more of a general concern that the family hub is not a huge amount of use to people in our area and possibly others. So it's not picking on this particular activity, but more of a general suggestion to link into community outreach hub if you're not, and get the youth offer out to the public, and don't assume the town and parishes will necessarily be able to help much. But
rural areas have a particular problem, don't they? I think the mention of the town and the parishes was not so much about communication, which obviously is important. I mean, and this is all public and the report is all public, but maybe we need to try and use our comms to get it out there, because it's important that people know we've been discussing this, and important that people know what's happening with, the information we've just been given, so they can sort of say, well, what's going on, because if we had them behind us, that is also really important. But I think the towns and parishes were mentioned to see whether they could provide something, for our young people. I mean, even if it's something like, I know one parish council is looking at a local piece of land and making it more user-friendly for playing. It's a bit slopey and uneven, putting an outside table tennis table there, So I think, all these little things, and I think there's a local, in this particular parish council, there's also a local person that is going to hold one of these sort of play bags where you can hire and go and play in the field, as we have on the leisure centre. So, parishes in their own small local context can do a lot, particularly if you're talking about a community that's a bit remote from everything else. I mean, I'm talking about Shaw Parish Council here, which is just one that I attend. So I'm quite impressed by their little initiatives, which I'd have thought, maybe other parish councils could copy.
Oh, I see. Yeah, I misunderstood it a bit, I think. Is there any funding for them then for doing that?
Well, this particular parish council,
I mean, just generally.
Talking about them, each parish council has some money from various sources.
Okay.
And they can also, through various things like members' bids, get money for various things, So, so there are ways that they can, and this is only a small pocket of money really, but you'll find that some parish councils do have funds that they can access, yeah.
Can I just come in on that? So, it depends on the parish. Some parishes have actually got a lot of money if they've had, a lot of building and SIL funds, but also crucially, the parishes can set their precept at there's no statutory limit. So if we can persuade and talk with the parish councils, it's potentially another way of raising some money from the local people to try and provide something for the children and young people in their area that we simply can't afford ourselves. But obviously, it's going to differ from parish to parish and what their circumstances are. Yeah.
For example, is Newbury Town provides some money for outreach workers from the waterside to support young people and bring them into the waterside. So that's another, and that's a reasonable amount of money actually. But there are bigger parish councils, so there are, if you have connections with your parishes and town councils, obviously it's something to possibly raise with them when you're attending their meetings. Let's see, which one? Who's first? Councillor Jeffrey.
Thank you, Madam Chairman. I suppose it's one of the things which comes out of this report very clearly is it's the 2 C's, isn't it? It's cash and COVID. And we've had the amount of public money going into mental health and children's mental health resources effectively being squeezed down and down and down. And the result that you get is that the problems go up. But then we load on top of that the experience of COVID, in which a cohort of children have been specifically hit by being the COVID generation that's gone through primary and whatever schools. So I don't think that we can ever close our eyes to the fact that you can be very frugal with your resources and get a lot done. But at the end of the day, if there are no resources, you're going to be very hard pressed indeed to have any kind of proper scheme running right the way across the piece. I think it's a message that needs to be a part of what we put through, that the cash has got to come from somewhere, whether it is government handing out money, whether it is getting funding for specific projects from within town and parish councils or whatever. But I think those are sort of the 2 comments that I would like to throw in at this stage.
Thank you, Councillor Jeffrey. Councillor Stevenson.
Yes, thank you, Chair. I, in my usual pedantic way, found 6 sort of English errors. Shall I just email them to you, Vicky, rather than bore the rest of the committee? Yeah, okay. Just, expressions. For instance, just one I wanted to bring up. Is trauma informed hyphenated or not? Because we're mixing it up. So we need to choose which it's going to be, trauma with a hyphen or without, and then stick to it throughout. That's just one of them. What I'd like to say about generally what we've been discussing is that I don't want to get depressed by that first bit of news, because we could become depressed because we put a lot of work into this. And I'd like us therefore to think that we have got a lot of other outcomes and recommendations that can be carried out other than by the ICB. A lot of other people can be involved, and we can carry those points forward, we hope, through exec and scrutiny and so on, without being fazed by it. But I'd also like us to go back and think that throughout the sessions we had, everyone who spoke to us, partners, officers, all those organisations, schools, they were so positive about us looking at this topic, really pointing out the need for it and being so happy to see us have a task and finish group on this topic. And so therefore we can't be knocked back, in my view. We must do as much as we can and hope that these recommendations are carried forward as well as they might be, please.
Thank you, Councillor Stevenson. Yeah, I agree with that. I mean, we learned so much, about what the different organisations do. I mean, even down to the volunteer groups, such as Swings and Smiles. I don't think we realised that they had a wider remit from just the children with physical problems, that they actually supported a wide range of people. So we learnt a lot. And we were very impressed by all the contributors that came and who gave their time, you know, including people like Berkshire Youth, and they were very valuable contributors. So, I mean, I agree with you, Councillor Stevenson. We must try and be positive and try and, you know, just push and not just sit back and say, well, we've done this, we've done our work, let's just sit back. That we must do our very best to, you know, support the council in what it can do, but also to lobby the ICB.
Yes, thank you, Chairman. And like Councillor Carter, I'm a newbie to this committee, so I'm treading very carefully. Just wanted to ask whether there was any, it's an excellent bit of work and very impressive and really well joined up. I think it's a very laudable tome. Could you just tell me, do we make any use of our connections with our maintained nursery schools as well, whose outreach work goes far beyond very early years and taps into the hearts of the communities and the needs, and certainly in many cases in deprived rural areas?
Do you mean like private nurseries?
No. I'm talking specifically about the Hungerford Nursery School and also the Victoria Park.
Oh, sort of the nurseries attached to the hubs.
The maintained, yes, exactly.
Right, maybe.
I think the easy answer is yes. Obviously, maintained nurseries would be involved in this. I think the maintained nurseries are also involved in the wider piece of work that Dave Rate's leading on the co-production that's ongoing at present, with an outcome expected in September this year about what the future of family hubs would look like and how they will play a part. I think just to pick up on Councillor Stevenson and the position about what the impact of this, the impact of us not addressing this currently, councillors will be absolutely familiar with the crisis that is underpinning the SEND system currently, but I'm sure you will also be surprised or not surprised to hear that emotional and mental well-being is one of the highest reasons for referral into children's social care as well. So both child and parental emotional well-being and mental health are significant for any aspect and any element of children's services currently, whether that be education, SEND or children's social care. So it's an area that absolutely must be addressed, and how we do that will be, as you've captured in your report, there are multiple ways to do this. It's not just a clinical or a medical approach. It is about engagement. It is around parenting support. It is around support to children and young people. It is around diversionary activity. It is around engagement, social cohesion. It's all of those issues coalescing really around emotional well-being. So I, like people who have gone before me and people engaged, do absolutely applaud the scrutiny of emotional well-being. But I think we must really understand as well the nature and the scale of the challenge on this. But yes, all elements of children's services are focused with one eye in terms of emotional well-being.
Do you think these changes that you've been telling us about, is this going to put even more responsibility and pressure on parents because they haven't got the sort of, I was going to say soft report, but the sort of non-medicalised support that you know, they've had in the past? Is that going to mean that there's more expected of them? And are we, I mean, we do provide support for parents, don't we, to help them with their, you know, their difficult job. I mean, that's still going to be there via our hubs and nurseries. Is there any way, because, you know, that was brought out in the report as well?
I think some of the questions that are being asked, I think they're the right questions. So I'm not being dismissive of the questions. I think the answers to some of those questions will come out of the work on family hubs, and I don't mean just children 0 to 4. So colleagues will be aware that family hubs in West Berkshire have essentially concentrated on 0 to 4s. Family hubs by the government's definition should be 0 to 19 or up to 25 where children have additional needs. We are some way off that. Councillors will also be aware that there has been a gradual erosion over a prolonged period of time of the early help offer in West Berkshire, and that's the funding that's available into that early help space. All of these issues create a perfect storm. I think we're in that perfect storm now. The government's direction currently around the Families First agenda, which you may or may not be familiar with, which is certainly something that will be picked up through children's scrutiny, brings the focus once more into early intervention and prevention activity. Much of the Family First reform and the new legislation that we'll be subject to from the 1st of April next year focuses again on early intervention and prevention activity. It's called Families First for a reason, because we know that children do best in their families. I think I would roll that into schools as well. Children with additional needs, so send children whose outcomes are best when they are educated in mainstream schools, whether they be academies or whether they be maintained schools, but mainstream schools in local communities are best for children's outcomes. We are challenged in West Berkshire because of the fall in numbers and the low birth rate that we have, and some of our schools are financially challenged, which puts them under additional pressure. So I think there are a number of elements that contribute to this. So again, I come back to the point that you are asking and exploring and poking the absolute correct subject area. I think the answer on that and where we get to in terms of children's outcomes and how we best support the best outcomes for our children and their families is a much bigger piece of work. But I think this was a great hook to start to focus in on in terms of the impact of where we need to best support children's outcomes.
Members are looking a bit bemused, slightly shell-shocked, I think, because, yeah. Yeah, so, I mean, we've got our recommendations. I mean, the options are on page 11. We can choose to do nothing, not refer them on to executive and decide that they're not appropriate. We can take them and send them to executive and ICB. With a covering letter. I mean, I don't think from what we said we have another recommendation, because the recommendations are referring to the discussions. But do we agree that we need to have a strong covering letter to what it would be both to the executive and the ICB to both, just saying we don't have to consider the wording now. We can discuss this with Vicky, and hopefully I'm really just to make sure we've got all our facts right, just expressing our concern about these changes or these proposals, and saying how strongly, we feel that this is about the future of our children, and that if we let services deteriorate more, we are, I think the perfect storm analogy is a good one. We're not in a good place now, but we don't want it to deteriorate. Right, Councillor Bennyworth, you stuck your hand up. Yeah.
Yes, thank you, Chairman. I know this is a final report we're bringing to a close, this piece of work, but given the information that Anne-Marie has given us this afternoon, is there a case of extending the scope of this? Question mark. I just wonder whether there's any scope in extending, sorry, any possibility of extending the scope of this working group, finding out how things lie further down the road, and then reassessing.
It will come back. I mean, what happens to the report? It goes to exec and the ICB, and then it comes back to the health and adult social care scrutiny after that. So it might be that at that stage, when maybe we've got more information and is clearer as regard the changes, that we actually think whether there is more we should do, or specific actions, maybe that would be more appropriate. Would that suit you?
That sounds very sensible, Chairman. Thank
Okay.
you.
Well, Madam Chairman, you were suggesting that you should write a letter, or you should sign a letter to the ICB, and I think that is the right way to move forward. So that they're extremely well aware of our concerns, that work that we've been doing and uncovering these various issues have got to be picked up. And if they're not being picked up by us as being the onward organisation that is going to be directly involved, because it's going to the health side, that we want to make sure. I do apologise. I don't mean to be rambling. I am saying that, yes, I agree with you, that I think a letter to the ICB saying how concerned we are that none of this gets lost just because we're handing over from one body to another or one funding stream to another.
Councillor Jeffrey, Councillor Constant.
Yes, thanks. So like Councillor Bennyworth, I wasn't involved in this beforehand. So if I'm asking stupid questions or making silly comments, there's nothing personal. I just not understanding the whole process. I've been on task and finished, but not this one. So I guess a couple of things. As well as the MPs, should we be writing to the Health Minister or something like that? Because if this is a fundamental issue that's affecting our ICB, I'm assuming there's more than one ICB in the UK, in which case they're probably affected as well. Which brings me to another broader point, which is also, should we be talking to other areas that are affected by our ICB, if there are others, if it's more in West Berkshire? Particularly maybe those in the other ones we may join up with at a later date, potentially, but not Reading, clearly. To garner more of a groundswell of support, because have they done the same task and finished reports? I don't know. If they haven't, then maybe they'll be interested in looking at our findings and maybe exploring that side themselves. And then lastly, I'm always a great one for where there's an action, there should be a time frame. I appreciate things go in and then they come back out, but none of these tasks have there's not even a plan to make a plan, I guess it would be my only comment. If only it's like, okay, when it comes back in 6 months' time, at that point, we'll agree timescales. So if we take the mobile phone position in schools, for instance, there is I can't remember, it may be Lincolnshire or somewhere like that, where they've done an experiment. St Albans, was it? Where they've seen a significant improvement in all sorts of things and metrics, including mental health as well and anxiety. So I, for one, am very keen on expediting that, which is why I was interested in there being timescales. And that's it.
Yeah, I mean, there aren't any timescales because it's not in our power to sort of say that. So this is it goes to executive, and that is where obviously a lot of things are to do with possibly funding and resources, and that's where those discussions will be. And also, I think if it goes to children's scrutiny, then things like the phone issue, I should think that's probably where that might be addressed, but that will be to do with the work programme of children's scrutiny. So, you know, there are places where these things can be discussed, but I agree with you. If you just send something off and it just hangs in the ether, it's not very helpful, is it really? And yes, as regards contacting other authorities, I did mention the Joint Health Overview and Scrutiny Committee, which is where the different authorities get together. It doesn't meet very often, but Councillor Stevenson and myself are members of that, and we could explore with them whether they have done similar work. I'm sure they'd be equally as concerned as we are. But we did say that we're hoping that they will be meeting soon, and that maybe, among other things, we might explore other authorities' reaction to this. Because yes, that would be much stronger if we all stood together and said, "Look, yeah." So definitely. Did you capture those points, Vicky? Thank you very much. did somebody else? Have we reached the end of what we feel we can usefully say? So I'm assuming we don't want to just do nothing, obviously. So we want to accept the recommendations here with covering letters to the different bodies that we talked about. And I think Vicky's noted all of that. And as I said, these will go to the executive and the Bob ICB. And then eventually we'll come back to a future health scrutiny. We don't know which one, it wouldn't be the next one, possibly December. But obviously, when we know it's coming to executive, I'd encourage people to, listen into that executive so you can at least be aware of how it's discussed. Even if you can't chip in, you could at least be there knowing what is being discussed and what the reactions are to it. So I will certainly try and be aware of when it's coming to exec. So I need a proposer and a seconder before we vote. Councillor Coulson.
I'm happy to propose, Chair.
Councillor Kander. You're
Happy to second.
Happy to second. That's great. Thank you. So Councillor Colston proposes and Councillor Kander seconds, and all in favour? That's everybody. Councillor Carter. Okay, thank you. Sorry, I wasn't looking over at you because you're over there. Okay, thank you, everybody. Councillor Stevenson?
Did we agree to write to the Minister of Health, which I thought was a very good idea?
All the comments I asked Vicky to make note of.
Because at least we get a reply, wouldn't we?
I would hope so.
Optimistically.
Yeah. I think as widespread as possible, I think as broadly as possible. And we will obviously be seeking, the wording and the appropriate way to promote this from Anne-Marie and Heather and possibly Stephen and anybody who wants to help. Just make sure that we say what we want clearly. And yes, and hopefully looking out for those responses. If we're not happy with them, we will keep on going backwards and forwards. Okay. Anyway, thank you for that. Yes, feel a bit down, but always hope, hopefully, yeah. But it's up to us to not just sort of say, oh dear, that we actually stand up for our residents and our young people, and we keep fighting for them. So, yes. So, thank you for your continued work. Yes, Councillor Codney.
Just to echo what Anne-Marie said, thank you for the scrutiny on this and bringing it out into the public domain, essentially. We talk about this all the time, so it kind of isn't news to me, and I don't go around sharing it because it can be a bit scary and a bit downing, but actually I'm quite glad it's out there. And yeah, please, take it forward and do something about it where we have been trying, but, in the background.
Well, it gives us an idea of what's really going on and what you're having to cope with. But, and I'd say just as members, we might be aware of things in our community, concrete examples of where the system isn't working. And maybe we should, if possible, try and capture those, and with residents' permission, pass those on to our MP and whoever is relevant, just so that, so that I have these concrete examples rather than just a general, if we know of them. Is that okay? Any more? Yes, Councillor Kant?
I was just going to say that the work has been worthwhile. I wasn't involved, but because the actions are the actions, the requirements are the requirements. How they're funded has to come somehow. And obviously if there's no funding, we'll have to find another way, right? But at the end of the day, these things need to be done. So from that perspective, it's certainly been worthwhile from your guys' perspective, and good work. Thank you.
Yeah, I couldn't agree more. When something's important, you find a way to do it, don't you? Really, and I'm sure we will do that. Okay, well, thank you everybody for your time and your contributions, and it's really useful discussion. And yeah, and it's obviously it's not finished. So yeah, see you again. Thank you very much. Thank you.